today live broadcast, we're going to be talking about kidney disease part 3. Remember, in Gateway 101, we do not diagnose or we do not treat. What we do is to create healthcare awareness so that if you are experiencing any of those symptoms that we mentioned, you can better seek medical attention. That's all we do. We're creating healthcare awareness in Gateway 101. We also places emphasis on prevention because we strongly believe that prevention is better than cure, and we also create healthcare tips that help you. Okay? And we also give you some healthcare tips that help you. And we also have a lot of simple home remedies in our YouTube channel at Gateway 101 that you can watch, and this will help elevate some illnesses. While this does not constitute medical treatment or diagnosis, what we are doing here is to create healthcare awareness. This is Gateway 101. So in today's live broadcast, we're going to be talking about kidney disease part 3. And this will be the last topic on kidney for now. So until we dig deeper into dialysis and end-stage kidney failure. So, but for now, we're going to be talking about kidney disease. And we said that kidney disease is when the kidney becomes damaged and cannot properly filter waste, which is extra fluid and toxic from the blood. Since kidney also help control blood pressure, balancing minerals, and make hormones for red blood cell production, kidney disease can affect the whole body. This is why you have to pay much attention to your kidney. Okay, so drink plenty of fluid to hydrate your kidney because it helps flush out toxic. Okay, so there are two main types of kidney disease. We have the acute kidney injury, also known as AKI. It's a sudden loss of kidney function, hours to days, but often reversible if treated quickly. Please kindly subscribe to the channel Gateway 101. Kindly subscribe. Thank you. So chronic kidney disease, CKD, is slow, long-term loss of kidney function over months or years. So the common symptom of kidney disease will be early kidney disease often have no obvious symptoms, which is why it is sometimes called a silent condition. So symptoms usually appear when damages become more advanced. So you will notice change in your urination. So urinating more or less often than usual. Foaming or bubbling urine may indicate protein loss. Blood in your urine. Pain or difficult urinating might be some of the common symptoms of acute kidney disease. So, frequent nighttime urination might also be a common symptom of kidney disease. So swelling, also known as edema, because kidney cannot remove excess fluid, swelling in the feet, ankle, or leg will be noticed. Okay, puffiness around the eye, swelling hand. Please kindly subscribe, and God bless you for subscribing. God bless you for subscribing. God bless you. So swelling, because kidney can no longer filter the excess fluid, and the toxic that is built up in the blood, you will notice swelling in your feet, ankle, leg, puffiness, especially around the eye, swollen hand, fatigue, and weakness. So kidney help make a hormone that produces. Please kindly subscribe to Gateway 101. Thank you all for watching. Subscribe to Gateway 101. Thank you all. So kidney help make hormones that produces red blood cell. So damages can lead to anemia. So you become constant tiredness. You have no energy. You have shortness of breath, loss of appetite, and nausea. So you have waste buildup in the blood. So when there's waste buildup in the blood, this can cause poor appetite. This can also cause nausea or vomiting. If there's a waste buildup in the blood, you will be having this metallic taste in your mouth. These are some of the common symptoms of acute kidney failure, kidney disease. So high blood pressure, kidney, do not forget to filter the blood and excessive fluid. So if there is fluid retention in your system, kidney disease can cause or worsen hypertensive patient situation. It can worsen hypertension. So because once the kidney can no longer filter blood out effectively, guess what? You will be retaining fluid, and this can worsen or cause high blood pressure. So persistent high blood pressure will be noticed. You headache sometimes. So these are some of the common symptoms of acute kidney disease. Okay. So skin problem. When you have a toxic waste buildup in your blood, waste buildup in your blood may cause dry, itching skin. You have this darkening of skin tone in several cases. And also, you might have muscle cramp and mineral imbalance, because kidney help regulate calcium, potassium, and phosphorus, which are essential minerals in the body. So kidney help regulate these minerals. Okay, so acute kidney disease might affect the kidney inability to regulate these minerals. So what you have a severe muscle cramp. You have tingling sensation. So, and if your potassium is high, you will be having irregular heartbeat as a result of kidney disease. So kidney disease, another symptom will be trouble concentrating or focusing. Sometimes you become confused. Confusion will set in. So toxic buildup can affect the brain. Difficulty focusing, dizziness, mental fog, all this can happen as a result of kidney disease. Okay? So when to seek medical help urgently, we said go to a doctor or emergency care if you notice severe swelling. Go to a doctor or urgent care clinic if you notice little or no urine output. You notice blood in your urine, seek medical help. If you have severe shortness of breath, seek medical help. If you have chest pain, persistent vomiting, because sometimes people with kidney disease have this nausea, vomiting because of the toxic build up in the blood. So they have persistent vomiting, so you need to seek medical help. Common causes of kidney disease. Common causes of kidney disease such as CKD, chronic kidney disease, will be diabetics, is the most common cause of chronic kidney disease. High blood pressure is another cause of chronic kidney disease. Kidney infection or kidney stone can also cause chronic kidney disease. So autoimmune disease like lupus can also cause chronic kidney disease. Long-term use of certain pain medication or certain painkillers like NSAID can also cause kidney disease. Okay, so for the sake of you who are just joining us, we're going to be looking at kidney disease early detection. How did they detect kidney disease? So let's look at that. So we said that catching kidney disease early is all about a few simple but powerful lab tests. So in other words, kidney disease can be detected with a simple lab test. Most kidney problems started silently. So to this are the best screening tools doctor may rely. So before you actually notice kidney disease symptom, it has already degenerated to advanced stage. It already deteriorated to advanced stage. So that's why constant screening and persistent screening is encouraged. So tests to detect kidney disease early will be the serum creatinine blood test. So creatinine is a waste product from the muscle. So if the kidney is not able to filter the blood properly, creatinine will be built up in the blood. And when the blood work is drawn, it will be high. So remember we said that for male adult, your normal creatinine level should be 0.7 to 1.3 for male adult. And for a female adult, your normal creatinine level should be 0.5 to 1.1 milligram per L plus slight DL. So if your creatinine level is high, or if your creatinine level rises, it may mean the kidneys are not filtering well. So limitation, creatinine alone can look normal in early disease stage. In early stage of kidney disease, creatinine level might be normal, especially in older adults or people with low muscle mass. Okay, so that test that may be recommended would be the estimated glomerular filtration rate, the EGFR. This one of the most important early kidney function tests. Okay, because it calculated using creatinine plus your age plus your sex. Okay, it showed how well your kidney filter the blood. Excuse me. So your estimated glomerular filtration rate, if it is 90 plus, it means it is normal. If it is 60 to 89, it means you're having a mild kidney disease. If it is less than 60 for 3 months, chronic kidney disease may be anticipated. So check with your healthcare provider, proper diagnosis. So if it is less than 15, kidney failure stage, so you may want to check with your healthcare provider. So best for detecting early decline before symptoms appear. Remember that before symptoms of kidney disease appear, it has gone to the advanced stage. So the early screening will go a long way to alleviate deterioration of your kidney, and it can also be reversible. So urine albumin to creatinine ratio, UACR. This is the best early urine test. It detects tiny amount of protein leaking into the urine. So if you have this bubbling urine, you have foamy urine where you pee, your urine foams, it bubbles. If you see some bubbles, know that you have a protein leaking to your urine. So it's a sign of kidney disease. So you need to go for checkup. Often the first sign of kidney damage. Okay. So UACR less than 30 may be normal. If the UACR is between 30 and 300, it's early kidney damage. If it's greater than 300, it's significant kidney disease. So you need to check. You need to go for medical checkup. Okay. So especially important in diabetics, high blood pressure. Okay. So urine analysis, which is a dipstick urine test, is the basic screening test. Although it's not as effective as the ones that we as the blood work, but the basic urine analysis will be check for protein, check for blood, check for glucose in the urine, check for protein in the urine, check for infection in the urine. Why use for fast and it is fast and cheap, but not as sensitive as UACR for early protein leakage. So blood urine nitrogen burn, blood urine nitrogen burn, and it's measure another waste product filtered by the kidney. So higher BUN may suggest kidney function. It can also rise due to dehydration or high protein diet or GI bleeding. So it's supportive, not the best early marker. So kidney imaging, ultrasound can also use to detect kidney damage, kidney disease, used when doctors suspect structural problem like kidney stone, blockage, a large kidney, crystal, or tumor. Not usually the first early screening test, but very helpful when abnormalities showed up during the course of screening. So blood pressure monitoring, not a lab test, but crucial. So you need to monitor your blood pressure because blood pressure can cause elevated blood pressure. Consistent and better blood pressure can cause kidney damage. So you need to check your blood pressure. High blood pressure is both a cause of kidney disease, a sign of worsened kidney function. So keeping BP control is one of the best prevention strategies. Okay, so electrolytes and acid-base panel is another test that can also be carried out. So kidney disease can affect the potassium, sodium, bicarbonate, calcium, and phosphorus. So this test will detect if you have a kidney disease. Often check once chronic kidney disease is suspected. So the blood work for potassium, sodium, bicarbonate, and calcium, phosphorus should be drawn. So best early detection, Cambo most recommended if you want. So the best screening package will be the creatinine, urine protein leak test, urine analysis, and blood pressure check. That combination catches most early kidney disease. Okay, so who should get tested regularly? You should screen yearly if you have diabetes. You should screen yearly if you have high blood pressure. If you have family history of kidney disease, you are over 60 years old, you should be tested regularly. You have swelling in your feet, you urinate frequently at night, you have a history of kidney stone, you're using a long-term NSAID used such as ibuprofen, you're using this painkiller, you need to be tested regularly. Okay, early warning sign but often missed will be kidney disease can be silent, but watch for foaming urine is an early sign of kidney disease. Foaming urine, that's protein. you have protein leaking, then swelling in the feet or face, you feel fatigue, you're having high blood pressure, loss of appetite. So these are early warnings, early sign of kidney disease. So let's look at preventive kidney disease. Let's look at some of the preventive measures we can put in place to prevent kidney disease. And we are saying that some of the early preventive measures we can put in place would be kidney disease is one of those things that often develop quietly. So prevention really matters. So the good news is a lot of kidney disease can be prevented or delayed with everyday health habit, especially if you start early. Okay, so the best way to prevent kidney disease is to control your blood pressure. Because blood pressure damages kidney. Okay, so high blood pressure is one of the biggest cause of kidney damage over time. So aim for a healthy BP around 120/80 if possible. So you need to reduce your salt intake, stay active regularly. Managing blood sugar prevent diabetes complication. Diabetes is the number one cause of chronic kidney disease. So keep blood sugar in a healthy range. Limit sugary drink and refined carb. Get regular checkup. Excuse me. If you are pre-diabetes or diabetes, drink enough fluid because water helps kidney flush out toxic. Drink steady through the day. Don't wait until you are very thirsty. Okay, more water is needed in hot weather or during exercising. But people with heart disease, kidney disease, may need to limit their fluid intake. They need doctor advice. Okay, you eat a kidney-friendly diet. So healthy eating protect kidney long time. So focus on fruit and vegetable if you're having a kidney disease. Eat whole grain, lean protein, fish, beans, and chicken. If you're having a kidney disease, we encourage you to limit your salt intake. Processed food, limit it. You can also limit your red meat intake. Limit sugary snacks if you're having a chronic kidney disease or you're having an acute kidney disease. So avoid overuse of painkiller. Frequent use of NSAIDs like ibuprofen, naproxen can slowly damage kidney if taken often. So use more when necessary as directed. Use only when necessary. I mean to say, use only when necessary as directed. Don't smoke if you're having a kidney issue because smoking reduces blood flow to the kidney and increases kidney disease risk. So quitting is one of the strongest protective steps. Okay, so maintain a healthy weight. Obesity increases risk of diabetes, high blood pressure, kidney strain, even small weight loss will go enough way to help. Exercise regularly, so movement improve circulation and lower kidney risk. So aim for 30 minutes most days, 150 minutes a week of exercise will go a long way. So even walking counts. Okay, so limit your alcohol intake if you're having a kidney disease. Okay, too much alcohol raises blood pressure and causes dehydration. So if you're having a kidney disease, you want to reduce your alcohol intake. Moderation is key. So keep regular kidney check, especially if you are at high risk. If you're a hypertensive patient, you have a diabetic patient, you drink alcohol, you smoke, you are at high risk. So you need regular kidney check. Okay, you should check kidney function if you have diabetes, high blood pressure, family history of kidney disease, you have swelling in your feet, face, or you have frequent urination changes. Okay, you need to check your kidney, do a kidney test. Simple tests will include blood creatinine level, protein, urine test. So prevent and treat function early. Okay, untreated urinary tract infection can spread and harm your kidney. So if you're having a UTI, it should be treated immediately because it can harm your kidney. So see a doctor if you have a bony urination, you have fever, you have back or flank pain. Early warning sign not to ignore would be kidney disease can be silent, but watch for swelling in ankle or face, foamy urine, blood in urine, fatigue or weakness, loss of appetite, high blood pressure. Okay, so we going to be stopping here today for this evening, for this night broadcast. Okay, so if you know that this does not constitute diagnosis or treatment. Okay, so if you're having, what we are doing in Gateway 101 is that we create health awareness. So if you're having experiencing any of these symptoms that we just mentioned, you need to seek medical advice, medical care. You need to seek medical attention. So we are only creating health awareness in Gateway 101. And we also have a home remedy that can help alleviate these symptoms. Okay? So until we come your way again, thank you all for staying with me to this late to this time of the night. So until I come your way again, stay well and stay blessed. This is Gateway 101. Thank you for watching. Let the good Lord bless you and keep you safe. Bye for now.